Well, it appears that the recent rise in Medicare per diems at the Guam Regional Medical City could not only affect public health, but private insurers as well. Here's more. In the aftermath of the Department of Public Health's announcement that they would only be covering emergency services for Medicaid and MIP patients at GRMC because of an inflated Medicare reimbursement rate, it appears even private insurance agencies may be affected as well. We met with Calvo's Select Care Plan Administrator Frank Campillo, who boiled down to simple economics, acknowledging that they too may not be able to afford a 400% increase.
Things are simple economics. If you quadruple my costs overnight, I may not be able to afford your costs overnight.
Reiterating the comments made by Public Health Director Jim Gillen, if the price of service goes up, people will naturally gravitate to a more cost savings approach, which could in turn force the private insurers to adjust their rates or adjust their plans. In the case of public health, he says the agency was forced to find a way to spend taxpayer dollars in the most efficient way.
And again, in many of these cases, it's simple economics of costs. If your costs become too much, if the cost in advertising at PNC News becomes too high, other people will gravitate to something
go to
else.
the cheaper one. Yeah.
Exactly. And in our case, we got to realize that, in not necessarily defending public health, but at the end of the day, those are taxpayer dollars anyway. It's every single taxpayer that is public health is taxpayers' dollars. So in their case, they're looking as to how to spend those taxpayers' dollars in a manner that are economically feasible for the community.
Public Health conducted a cost analysis for fiscal year 2017 that shows GRMC's new per diem rate of $5,075 will cost them $23 million. If the rate were to be based on GMH's $1,123 per diem rate, it would only cost about $10 million. Gillen emphasized, though, that his decision to terminate a contract was a business decision. Although the $5,075 reimbursement rate was only approved by CMS last month, the rate is retroactive to the date that GRMC became Joint Commission accredited back in January. And while GRMC and Public Health are at odds over whether there is a breach of contract because of Public Health's abrupt decision to limit coverage at the new hospital, Campillo says he thinks at the end of the day, GRMC and Public Health will find a way to work the issues.
In their defense, remember that this issue with Public Health is not something that they initiated. It's something that Medicare, which is Medicare, which is the federal government, says we are going to increase your rates. And unfortunately, Medicare, which is one portion of the House, so the Centers for Medicare Services, the other portion is now Medicaid, which is our public health, is saying, oh, what Medicare is offering you, unfortunately, is something that we may not be able to pay to you.
And for more, be sure to, of course, log on to our website at pacificnewscenter.com.